Welcome to NP's Changing Practice. I'm Dr. Carol Berger.
Hi, I'm Dr. Nina Zimmerman. Welcome back.
Yeah, sorry, we've been away this summer. Both of us have had, vacation and getting ready now for the new school year to start. So wanted to say that we are going to be back on a weekly basis and giving you
Yes.
tips and resources and different things that might help make the school year a better year for you, or if you're in practice, just clinical pearls that we've learned along the way.
Right.
So tonight we wanted to talk a little bit about resources. Students ask us all the time, what are our best resources? What can we,
Carol. Yeah.
And in clinicals, you teach a clinical course, Nina. So so we're gonna share some resources that we think are good resources for you. So I'm going to share my screen for those of you listening. You can go to these websites too. We'll also be posting this presentation on our website, NPS changingpractice.com. I think.
That way, if you all are listening, you might remember a few that you want to look up, but if you check out the website, but if you're just listening, you'll remember some of these things that you might want to access.
So the first thing that I want to talk about is up to date.
Yes.
Up to date is probably the most utilized resource by nurse practitioners. And Nina, you go ahead and talk
Sure.
a little bit about that, and I'll try to find it to open it up.
Oh, sure. So up to date is just that. It's an up to date database. It has everything in it. And those of you who have an electronic medical record, such as Epic, many electronic medical records across the country have up-to-date built in. So it's something that if you're a new nurse practitioner or student, you might want to ask your preceptor, hey, do you have any kind of database of resources within your medical record chart? Because I know for Epic, for Carol and I in the St. Louis area, we some of the systems have up to date, and you literally
VJC does,
SSM.
Sometimes you have to look for it. You got to go under the little tab where but it'll give you the up to date. Some places have it as a icon on the
on their internet.
For students, those of you who are with Maryville, for sure, we have up to date, and I've got it open right now.
Right.
You can see that. It is in the library. You go to the library and you go to where you're looking up journals, and it's under the U. You go to U.
Under databases. You have to select databases, and it's there. And so if you are in an NP program, many NP programs will have this in their library. So as a student, you can use this. As a student, I had it open when I was in school years ago, so that I just had it open on my laptop. Like I said, check if your medical record has it, and then you can access it. It's literally a database where you put what you want in that search bar, such as, abdominal pain for an adult, and it brings up guidelines. And it literally summarizes to today, most up-to-date guidelines. But what you have to be careful about is not only the published up-to-date guidelines, but then it'll have like articles or research. COVID, obviously, it's key to have all that updated. What's the latest research on, long COVID or signs and symptoms or the latest strain. So, it's a very helpful database.
Okay, so this is up to date. So we go to screening prostate cancer. See, one of the things I love about the screening prostate cancer.
Prostate cancer?
Prostate. What am I saying?
You kept saying prostrate. It's prostate.
Prostate. Okay. Yeah, you're not laying down. But prostate cancer is what we're talking about. But I love about this one is that it gives you all the different societies and where you can, because there's different guidelines for different organizations. So let's say the Urological Society might have one interpretation, and you might have the Cancer Society have another recommendation. Somebody else. Well, in this particular one, if you read through here, it is going to tell you what all the different you know what? It is not prostate, it's testicular cancer.
Testicular cancer, prostate cancer screening. Yeah.
Yeah.
Prostatitis.
Yeah, but now testicular cancer, I kept looking for it and I couldn't find it. Testicular cancer is here, and it shows you, look at here, recommendations of others.
Yes.
And this gives you all, so you can see that, oh, the United States Task Force is different from the American Academy of Family Physicians. Now, as you can see, for prostate cancer, it didn't give us all of those, right? You would have to look those things up yourself by going, Dr. Zimmerman's right, you have to go to the societies to find out. Breast cancer is another one. I mean, the Cancer Society might be different than, you know, the OBGYN Gynecological Society.
Right.
Let's say you were trying to find out the most recent guidelines for COVID. You could put in COVID and you could go to COVID homepage and it gives you everything, up-to-date pathways. You know, just whatever you need. And they have beautiful charts and algorithms.
The algorithms are amazing, aren't they, Carol? You can just click, you can print them, you can click on boxes and it notes, you know, what you have to screen for, yes or no. It takes you all along the way. I just think what you just said, Carol, is really important. And that is, when you look at up to date, it's going to give you lots of options of different societies and different US guidelines, US Preventive Task Force, European guidelines. But what's important is that you can get to all this information at your fingertips. But like we teach you, and like you're going to know as a student and as a practicing NP, all of this information is great, but you have to make a clinical decision based on your patient and what your clinical decision making is, your critical thinking. So, you know, you can have all the information in the world from up to date, and it's great because it's at your fingertips for school and for a lot of electronic medical records, or having it. Hopefully you won't have to purchase it because it's very, very expensive. When I was first an NP, I purchased it. It was like $600 a year, and you can do it as an app too on your phone. But
get a discount. So you
can get a discount. But the point is that this is a vital resource that Carol and I use, but you have to know how to get the information, how to review it, and then take that information and apply it to what's going on with your patient, right, Carol? Because you may see 3 different, you know, recommendations or algorithms or whatever, and then you have to quickly put that, you know, critically think and transfer that knowledge into practice. So this is really just a reference, right?
Right. That's all it really is. And the other thing I like to tell students is, if you scroll down to the bottom of up to date, it does give you, like, I'm looking at the treatment of anemia right now. So I'm going to get the best guidelines, right, of what they're telling me to do. And Dr. Zimmerman's right. You know, you have to decide what you want to do. But look at here. Here's all the references. There's 100 references here. And let's say I wanted to do the single dose intravenous iron for iron deficiency. You can just click on it and it takes you to the PubMed link.
Can you believe that? I mean, Carol, Dr. Bergen and I have been doing this for a long time. When we first started as NPs, we had none of this. The fact that you all have this at your fingertips is amazing. It's amazing to me.
And other things we want to show you too, but up to date is by far probably the one that if I had to do without something, I would have to say, no, I can't.
Nope, I can't get without this. Yep. That's the one that we use the most. It also has screening tools too. So not just diagnostic criteria, it'll have individual medication information. It'll have screening information. Like, let's say you didn't know anything about the PHQ for depression. It will have that information. It'll have the screen on there. It'll how to understand what the results are. All of that at your fingertips. It's just, and even some calculations too, which may bring up to another resource that Carol wants to talk about.
You can get the drugs, like what you should use. Like for a good example is that the guidelines for pneumonia treatment have changed.
Yep.
So data is going to tell you what medicines you should be choosing now, right? And we use a combination. But Hippocrates, you don't have to pay for that. So that's Hippocrates.
Yeah.
Right? Hippocrates, I've got this up. This is the free version.
Yes.
I do not recommend for some of you to have to spend the money on this. 'Cause
No,
that it is as up to date. What do you think?
I agree. There's some great resources such as Hippocrates and MPR. M as in Mary, P as in Paul, R, MPR. Those are applications that you can get for free. And they have information about any medication you want. MPR has an app. It's a free app that you just have to sign up for as a nurse practitioner, as a nurse, a student. And it has the medications, it has calculations. So any kind of calculation that you're using, there's calculations in there that you can use. There's other resources as well. You can put interaction information, drug interaction information. So Hippocrates and NPR, I think, are the best for, in our opinion, for looking up medications quickly and for free. As long as you look at the most updated version, either online, like if you're an online kind of person, when you work from your desk and you want to have it on your desktop, or I like to have some of the apps on my phone. It just depends what your preference is.
And I have Hippocrates on my phone for absolute sure.
Yeah.
So for dosing though, I will always use Hippocrates.
Mm-hmm.
Let's say I wanted to look up Augmentin, right? Okay, so I could look up Augmentin. It's going to take me to Augmentin. And so here I've got, here, the things I love is I have my
Yes.
which is very important. I have my hepatic dosing because when you renal dose, you have to renal dose all your meds. You have to make sure about that. But let's say I'm treating community acquired pneumonia. It tells me 500 milligrams per 125 milligrams. Every 8 hours for at least 5 days. So they're wanting me to use Augmentin.
Mm-hmm.
And it tells me how much, right? UTI, how much, or sinusitis, how much. So, and it gives you your maximum amount for your pediatric patients that they should have per day, which is really important. The other thing I like here is my interaction checker. In here, you can put 2 meds. And, if there's just 1 or 2 meds,
yes.
But when you get 3 meds where there's a problem with the same issue, then you have a problem.
Yes.
Right? Like lithium, you could put lithium. Let's say you've got somebody on lithium and you want to give ibuprofen to them. Oh, I probably spelled that wrong. Let's do Motrin. Okay, it's going to say modify the treatment.
Yeah.
Right? And then let's say I wanted to put tramadol as well. Now I've got 2 that do the same thing. So that's going to make this person lithium toxic.
Yep.
Love my interaction checker. Now
I do too.
Here too, you can find calculators. I don't find them as many. We're going to go to another site that I just found out about that I love. But here's your cardiac output, and things like that. The one I use, you can go by specialty. So this is cardiology. Let's say you wanted to, figure out how the risk score for
yes.
coagulant or but the one I use the most, what are we most worried about is kidneys, right?
Yep.
So I go to, where the heck is it? Nephrology. Right. And then I want to get my creatinine clearance. And here is my creatinine clearance. So I can go to my creatinine clearance and then I can put in my urine creatinine, serum creatinine, or whatever I'm doing. And it'll give me my equation and it'll tell me what I'm doing.
Yeah, that's really helpful. It's also helpful to, if you didn't remember the CURB score for pneumonia, if you're thinking about whether or not you're going to admit somebody for primary care, pretty much you're going to do by your critical thinking. But let's say you wanted to use something like that and it's not in a lot of these are going to be in your electronic medical record, but that will be in there. Or maybe you want to know the severity of asthma, that's probably in there, or COPD.
I wonder if they have CURB 65.
I bet you they do. Let's check. No. I
see oxygen peak flow, maybe COPD assessment.
Yep, COPD assessment. There's probably the asthma control, ACT.
So there is your CURB 65.
Yeah, CURB 65. So you can decide if you, if you're waxing and weaning, whether you're going to admit somebody, remember the CURB 65 pneumonia severity score. You're going to determine if somebody's confused by mental test. what their urea is, their respiratory rate, blood pressure, and then it actually calculates a score whether or not they're low, intermediate, or high risk to admission, to decide about admission or not.
So you can use this through Hippocrates. In another area that you can use this, and let's see if I can make this work, that I just found out about. I was actually reading a note, and it said that they had figured out the deficit of water.
Oh, yeah, this is really interesting.
By MedCalc. And I thought, how cool. Here you've gotten this. So you've got your popular ones right here in the front. So I kind of like that, because this sometimes, like in Hippocrates, it gives you 4 different creatinine clearances. And this is the most commonly one used. So this one kind of takes that away for you. Our CHAD score, calcium correction for hypoalbuminemia.
Oh, yeah.
Huge, right? MELD score for your end stage liver disease, CHAD score. So these are, SIRS.
Wells criteria for pulmonary embolism. That's a good one if you all are in urgent care or ER.
I mean, and this is all free. So take some time and explore these. And of course, you can get the newest of favorites. You can make your favorites. You can put this on your phone, and you can just have it as a favorite on your desktop so that you can find out. And here's guidelines.
Yeah, that's another one I wanted to talk about. So the one that Dr. Burgers called is MedCalc. There's some guideline apps that are really good. The MedCalc has guidelines. And then I have this guideline, what is this called? Guideline Central. And it's an app. It's also online. So let's say you wanted to look up the guideline for the American Diabetic Association, or the guideline for STI infections for treatment guidelines. You can look that up probably in this MedCalc or in something called Guideline Central. The Guideline Central one has the US Preventive Task Force search. You could put in an age and sex, tobacco use, sexually active, and then you can search for all the applicable US Preventative Task Force screenings for that patient. It's really helpful. So that's MedCalc is the one that Dr. Burgers talking about, and I'm talking about Guideline Central. Guideline Central. You can do those both online and as apps.
And so lots of algorithms too. So take some time here and look this stuff up, because really, really very helpful for you. And then find the ones that you like the most. Then a couple other things I wanted to take you to in family practice. You're going to use CDC. Are you still seeing that? CDC?
Yeah, CDC is, that's a really, You could just do www.cdc.gov. These are also applications as well.
And look at what you have here. You've got healthcare provider. When you go into the healthcare provider, and this gives you the chart for your child adolescent schedule, your adult schedule, clinical vaccination resources, download schedule app for healthcare providers. So you can download an app that will help you figure out what immunizations you need to give. And I can tell you as a family nurse practitioner, when you have kids coming in, rarely are their immunizations all up to date. And so then you have to play catch up. And
right,
that's a whole different reading section. And if you've got a couple of kids back to back and you've got immunizations to give, you really behooves you to have some kind of a tool to be able to plug in what they have to give you what you need to give that day. Because, if you just think it's going to be right on schedule every single time, it's not. So
no. And some of the medical electronic medical records has some things built in, but I find them confusing. I like to be able to look at something like this, because if you have a schedule in front of you, maybe I'm old school, I don't know. But if you have these schedules, sometimes they have these pocket guides or an application. I love the CDC one where you can look it up quickly, or like the CDC one, you can actually put in their age and their sex, and it will come up what's important for that age and sex group, if they're tobacco users, if they're women, if they're pregnant. I mean, it's kind of like your tools in your toolbox. What's easiest for you? Dr. Berger and I like certain things that we put that we have available for us on our laptop and or our phone. You might those of you that are real tech savvy, you may be just fine with using your electronic medical record for a lot of these resources, but it's really important as a new practicing nurse practitioner to have these tools and use them, practice them in your clinical setting when you do clinicals, because then you'll say, this was helpful. And then you'll be like, this one isn't helpful. I just think that's does something differently, and ask your preceptor, what are the resources you use in practice, and you'll learn something from each preceptor.
I try to get my students to start using these things as early as possible. Start looking up things, because then if you have to look things up multiple times to be able to. And the more you look it up for a real scenario, the more it's going to stick. So try playing around with these and looking them up yourself, getting them on your phone, the ones that you think you're going to use. Another favorite of mine is, let's see if I can click it and make it go there. Do you see the United States Preventive Service Task?
That's what I was talking about too. And that is an app as well. Yes, that's something I have on my phone. This U.S. Preventative Task Force shows up as an app and online, and you can just plug in on the app. On the app, you can do the age and the sex and all that, and it just things show up. But I like this too, what Carol's showing. For those of you who can see online or think or just listen to what we're saying, is when you do it online to U.S. Preventive Task Force website, you can just have links of all the different screenings right at your fingertips. Well, and on an app, it'll do it for you too.
Yeah, I put in breast cancer screening. Okay, so let's just look at breast cancer screening. And what is the recommendations? Now, this is just the United States Preventive Service Task Force.
Yes.
The American OBGYN Gynecological Society could have different recommendations, and the Cancer Society could have different recommendations.
Right.
One of our challenges is trying to figure out what is the right thing. But here, for women aged 40 to 49, they say we should start screening prior to age 50. Should be an individual one. Women who place a higher value can have more potential harm, but biannual screening is what's recommended by them in the ages of 40 to 49. Again, it is an individual situation. If you have a woman who has a relative, close relative, let's say their mother's sister, breast cancer at age 30.
Yep.
That's a whole different situation. And you might have to say, okay, that just because this says don't wait till 49.
Right.
You have to adapt that. But you can look up you can search right here for any of the recommendations that you want for screening tests, for depression, for anxiety, for colon cancer, for prostate cancer, prostate.
Yeah. Yeah, yes.
Forever. Okay, so those are my favorites.
Okay.
MedCalc is a new one now. CDC and US Preventive Service Task Force. So now you're going to talk about some apps that you absolutely.
Yeah. So we talked about some, and I'll just say them again. One is MPR, Mother Paul Run, MPR. And that used to come in a book for those of you that are listening there and that are NPs for a while. But now it's a free app. And the reason why I like it is every time you open it, it updates, and it's free. There's a way you can update it every time you open it. It has medications on the app. It has calculators, charts, and then latest news. In the news, it's really great because you have a summary at the bottom of your homepage of what the latest news is in treatment, such as this one says there's a long-term plaque psoriasis new influencing clinical decision-making that was published July 26th. So it's there and you could read it very quickly. The drugs are very easy, and it's by disorders. Or you can actually put the medication, and it gives you charts, like a quick chart, Carol, how you do your steroid creams and your creams for fungal infections or tinea. It'll give you a chart for the potencies and the typical grams of what it's available for. And so I love MPR as an app. The other thing I love as an app is called the Guidelines Central. That's the one where it's based on the U.S. Preventative Task Force. You can look up any guideline. It also has calculators, medications, US Preventive Task Force, trials, and PubMed on it, and that's free, and I love that one. So those are very similar to what Carol talks about. I have Epocrates as an app on my phone. The other one I use a lot is the CDC STD treatment guideline. It's being updated right now because there's new guidelines in 2021. But if I have to look that up quickly, I can use that in other apps as guidelines. But the CDC STD treatment app is really nice because it's per condition and you can look it up quickly. But that one's being updated as we speak. So I usually go on the CDC website like Carol was talking about. The other one that's really helpful is to have something for derm. So I have a couple of derm apps. One is this Fitzpatrick Color Atlas and Synopsis of Clinical Derm. And the reason why I like it is because you can put a history of the rash in there and it'll give you some things to think about. I don't use that a lot. I usually just use the table of contents where it has pictures, it has disorders that are typical for certain areas of the skin. It has images, and then of course it has treatments, and it's really easy to use, and it was free. You can get Epocrates as an application that we talked about. The other one is the Sanford Guide, the antibiotic Sanford Guide. That's really helpful. It does cost a little bit of money, not much. I can't remember how much I paid for it, but if you are somebody that uses a lot of antibiotics, maybe you're a hospitalist or somebody that wants to know about antibiotics. Now the Sanford Guide is more than just antibiotics. It used to be just an antibiotic guide, but it has HIV, it has different drugs, it has prevention, it has different you can search by different pathogens if you're looking at a path report. Regional guidelines is nice. So I love that. And then what is this one? This one I'm looking on my phone is the Society for Lower Genital Tract Disorders. I was using that for a while, especially if you're in a specialty area, because it has primary screening on it. So, most often I use Epocrates, Guideline Central, the Derm one, NPR on my phone. The other things I would recommend is I have a quick anatomy guide on my phone. So let's say I just not remembering documenting something intricately in the hand or the shoulder. I have this pocket anatomy application that's really neat. So it can give me some guidance if I wanted to do something with my documentation or what I'm thinking about for physical assessment. So those are things that I use frequently.
I think too, we need to look for one that I'm looking for is, since people are taking over the counter,
yes,
kind of things, Epocrates does for a fee. You can upgrade to where you could put in, like, if they're taking some, ginkgo or something that, we don't know. And maybe it's going to interact with St. John's wort. St. John's wort, we know that one.
Oh, yeah.
But some of the other ones we don't have as much. So Epocrates, you can upgrade to that. I don't know of a free one, but hey, this is where we need your help. First of all, this is what we're going to do for you. We're going to put all of these apps on a special spot on our website so that you have links to all of them. Okay. And we'll be calling it probably, favorite links or something like that. So it'll be one of the bullet points. If you click into that on our website, it'll take you to all these different apps. And so you can look them up yourself.
And links. Yeah.
And download which ones you think are good for you. Both good for students as well as for our new NPs, our older NPs. And what we'd like for you to do is to comment and tell us what apps or areas that you found really helpful so that we can put that in our little library, our toolbox. Maybe that's what we'll call it, our toolbox for NPs, right?
Yeah. And if you guys email us, and Carol can mention what the email is, or just comment, we can maybe mention those comments. We'll mention you on our podcast. So we really value your opinion. It would be nice if we had some comments and things to mention on the podcast, right, Carol?
Absolutely. We need to know, what do you need? What we are here to do, our goal, our mission is to help students primarily, right, who are trying to get through school. That's why we started the podcast, was to help socialize them and get them the resources they need to help them study and pass their classes, to socialize new NPs, and to be a resource to pull all of this together. And we can't do that without your help.
That's right.
Please comment, please let us know what you want to hear more about, and we will do that. So we encourage you. We're going to be diligent now. Summer's over and we are back to work. So we are going to be weekly bringing you some broadcast from more episodes of NP's Changing Practice.
Take care now.
All right, see you next week.